Hello, and thanks for joining us for the StatRad presentation, the 2020 Virtual Career Symposium sponsored by UCLA. What we're going to do today is tell you a little bit about our company and also about our practice and potentially why you might be a fit for us. So a little bit about the company. We were founded in 1995 here in San Diego and have been going ever since as a privately held and physician-owned practice. And one of the things we did that was very unique was we actually developed our own radiology information system in PACS designed specifically for teleradiology. So there's a lot of workflows and things that we needed to do to really leverage the power of the internet. So we've developed it all internally. We actually had developed a PACS that was sold to Change Healthcare. So we're really specialists in that piece of the business. Where we've continued to expand is outside of California, and we're now servicing about 500 hospitals across the country. And because we leveraged the internet when the industry moved from film to digital and really built from the ground up our own technology system, all of our radiologists can work pretty much anywhere they want to in the United States. So we have over 80 radiologists working in multiple states across the US, in places like Hawaii and California and others. And they're having the same kind of performance as if they were sitting in the room with the PACS. And that's because of our specialized workflows and technology. So I think the key thing to remember about our company is we're privately held. We're one of the largest, if not the largest, pure teleradiology company in the US. We don't take on direct contracts. We contract with radiology groups as our partners, and we will stick to that strategy. We're completely owned and controlled by ourselves, and so that'll allow a unique work environment that you really won't find in too many other places with our size across the U.S. So with that, we're going to allow Dr. Justin Yoon to tell you a little bit about the medical practice. He's our medical director, and we'll take it from here.
Thank you, Claude. So as Claude mentioned, we have 80 radiologists. We are actively recruiting. Primarily, we are looking for full-time radiologists, but we are also looking for the correct fit in part-time radiologists as well. The vast majority of our radiologists are fellowship trained. The top fellowships that we have are neuroradiology, musculoskeletal radiology, as well as body imaging. We have an interview process which involves talking about what our practice offers, what any questions that you may have, as well as a case vignettes quiz. The case vignettes quiz is a way for us to assess the abilities of the radiologists in the remote environment. We have a high retention rate, and with that, I would like to talk about some nuts and bolts of the practice. So StatRad provides a full, complete workstation, standard 3-monitor setup, CPU tower, with all the necessary accessories. We provide 24/7 IT support for you. We have imaging coordinators that are crucial for the function of all of our radiologists. One of the main duties of the imaging coordinator is to work alongside you virtually and to be there to help you call all critical results and do the documentation on the back end. Their role is to increase the amount of time for you to perform your interpretive tasks and reduce the non-interpretive tasks that many of us feel bogged down with. Full-time schedules are typically 7 on, 7 off with 9-hour-long shifts. We have flexible alternative scheduling options. So what this means is that we have radiologists that work more often than 7 on, 7 off, and sometimes a little bit less. We have radiologists that work only weekend schedules, as well as 7 full shifts per month. One thing to remember is on a 7 off, 7 off schedule, you will have 182 days off per year. The case mix is approximately 2-to-1 ratio of preliminary to final reads. In terms of modality, about 60 to 65% will be CT, 18 to 23% will be X-ray, 3 to 5% MRI, 8 to 12% ultrasound, and less than 1% nuclear medicine. Our payment model is based on productivity and efficiency. We have a highly competitive RVU, productivity-based compensation model. Everything that you read, you will be paid for once per month. So why would you want to go into teleradiology out of residency or fellowship? Next slide, please. Thank you. So one of the primary reasons is you can select where you want to live and work. The teleradiology position is portable. We have radiologists in all four time zones, except for Alaska. We are a stable practice. We provide flexible schedules for you. We have industry-leading compensation, and we have the licensing and credentialing staff, as well as the imaging coordinating staff, to reduce the amount of non-interpretive tasks for you and improve your productivity and efficiency. Please reach out to us if you have any other questions, or if we can introduce you to a teleradiology position. Thank you.